So I'm really happy to talk to the audience about a really important topic and project which the Fraunhofer Academy, four Fraunhofer institutes, the Universidad de Barcelona and Oxford University NHS hospitals are working since 2 years on this topic. It's about the importance of digital skills in healthcare and, oh, sorry for that, and how to enable professionals to drive digital health. But before we start with the topic, I would like to introduce you to the Fraunhofer Society, which usually is best known as the Fraunhofer Institute. But that doesn't simply exist because, or exist in a multiple form, because the Fraunhofer Society consists of 75 institutes and research units covering 29,000 persons of staff, from which 25,000 are focused on research and education. And I think this is really important to mention, because mostly when you talk about Fraunhofer, it's always the institute, but then we talk which of these 75 you really mean. So it's a really big European research and development organization. And the focus of our fields of research are, of course, health and environment. I think roughly 30 Fraunhofer institutes are involved in this area. We have about communication and knowledge. So, for example, what you might have heard in the newspaper, it's about the quantum computing, which is an important topic about that. It's mobility in transport. Here you might have read about the research factory of battery development in Münsterland. We have about energy and resources, security and protection, and production and supply of services. And for each of these fields, the Fraunhofer is not only offering research services, but as well education services. And that's the Fraunhofer Academy, which is a kind of hotspot in the network of the Fraunhofer Institutes, and is orchestrating roughly about 40 institutes which are contributing with their experts in transferring the know-how into the industry. So the idea to develop a program to support digital transformation in healthcare was born in 2019, when we discovered that index chart of digital adoption by sector in Germany. And that chart has been constant for several years. So healthcare is ranking last far behind within the index of the digital adoption by sector, and that has been constant for several years. So health organizations remain partially unaware and largely unprepared for the large-scale upskilling of the workforce that will be required to cope with and to benefit from the digital innovations. And this chart is particularly for Germany, but despite more progress in front-runner countries like Estonia, Denmark, Canada, and Israel, so this is valid for most other countries in Europe and even worldwide. And even in international context, Germany is ranking far behind compared to other countries. So it's a rank 16 of 17. And in Germany, we have the exchange of information like medical reports, medication plans, mostly on paper. And with our electronic health record and telematic infrastructure, we are really occupied in the basics or the backbone of digitalization and networking. So with far front of us are Estonia, Canada, Denmark, and Israel, and Spain. So this is a really topic, urgent call for action to really get more power in the digitalization of the healthcare systems. But nowadays, there is a lot of dynamic in the healthcare sector, and there are 3 market forces which are driving change and transformation in every business, and particularly for the healthcare sector. The first force are the economic forces. So this is what is changing financially in the market, and the global healthcare spending as a share of the GDP will rise 5% per year till 2023. So this is a huge amount compared to all the efforts, and particularly increased by the corona pandemic. And before pandemic, the spending for the global telemedicine industry was expected to grow till 2025 by 15% per year, but now it's as well, due to COVID, it's 19%. And the global virtual diagnostics industry is projected to grow 15% annually till 2030, from the basis of 425 million in 2019. So these are quite impressive numbers, maybe not taking into account how exponential growth might affect these forecasts. Despite these investments in the healthcare market, it is no secret that the healthcare systems across Europe are under pressure. So a combination of the COVID catch-up, aging populations, and high expectations increases demand for healthcare. At the same time, staff and other resources are in short supply. According to a study of Deloitte, Europe is expected to be short of 4.1 million healthcare workers by 2030. So that's over a quarter of all posts unfilled. So that brings us to the second force, the social forces. What is about emerging changes in people's behavior patterns which exist. So let's have a closer examination on why healthcare systems are becoming increasingly unbalanced. So it's about the increasing demand. The scale and complexity of healthcare needs have grown, together with the public expectations of a more personalized and convenient services, ensuring the equity of access to healthcare. The aging populations, in Europe alone, in the European Union alone, we have over 200 million people who were aged 65 or older in 2019. And there will be a greater medical complexity. So over 50 million people in Europe live with more than one chronic disease. On the supply side, at the same time, the resources have become increasingly constrained, and the gap between supply and demand has grown. So most countries have seen a decrease in the number of hospital beds per 1,000 population. And from these expected 4.1 million shortage of healthcare workers in 2030, it's alone 600,000 doctors, 2.3 million nurses, and 1.3 other supporting staff in the healthcare. In addition, staff burnout, with around a third of the European clinicians thinking of leaving the profession, increases the pressure on the healthcare system. I got the message. So is everything right with the presentation? I hope so. So please give me a note if there is, because I got information about increasing windows on the screen. So I just continue if everything is okay.
Seems okay.
Okay, thank you very much. The third forces are technologies. So the technologies can flatten existing business models and even entire businesses, because due to demand shifts from one product to another. And while COVID pandemic has disrupted the healthcare and caused radical shifts in the business models, it has in parallel accelerated the pace of digitization. Clinicians are empowered by new diagnostic and treatment paradigms. For example, in 2025, the advances in artificial intelligence enabled robotics, in cognitive automation and digitization are helping healthcare professionals to work more productively, because they are augmented by technology and they are going to transform their ways of working. So there will be more focus on cognitive, analytical, and emotional skills, and less on administrative tasks, which are unfortunately actually consuming considerable resources from clinicians and nurses. So this leads to a re-architecture of the who, what, and where work is done. For example, about the what, so the automation, increased automation, and the cognitive and artificial intelligence technologies have changed the perceptions of what needs to be done by humans and what work can be done with smart machines. Regarding the who, the workforce, who does the work, technological advancements are enabling new models of interaction between employers, workforce, and patients. This leads to task shifting and task reorganization that have led to a more diverse and, most important, multi-professional blended workforce that is employed across more permeable boundaries, and we will get rid of these silos which we actually experience in the healthcare system. Regarding the where, the proximity, these technologies will lead to a rethinking combinations of talent, technology, and workplace. So it is really to be discussed where the workforce needs to be located to deliver the services and support the patients, including remotely, and reshaping where when the work gets done. So in summary, when we consider these three forces together in their mutual interaction and impact, we will get an interesting cocktail for the healthcare system. One could assume that everything is fine because we have increased spending in healthcare. We have technologies which will support efficiency and productivity in healthcare, and this might be sufficient to close the gap between demand and supply. Indeed, digital technology has the potential to transform the way we deliver care. A study by the Information Technology and Innovation Foundation, for instance, estimated that mobile health alone bring 400 billion cost savings over a 5-year period, enough to fund 2 million of that 4 million workers shortage. Other industries have experienced productivity gains up to 20% from digitization, but healthcare delivery has yet to realize such gains in a long way along. One of the reasons for this is the lack of digital skills in healthcare, leading to a poor adoption of new technologies. For example, the Topol review in 2019 called for an urgent upskilling of the workforce, and this has become even more urgent in the pandemic. However, healthcare staff have varying levels of basic digital literacy, and they are overworked and under time pressure, often required to do this training in their personal time. According to a survey of 1,780 clinicians conducted in March and April 2020 by Deloitte's Healthcare Consulting, organizations are facing many challenges in implementing digital technologies. Apart from the first one, bureaucracy in healthcare, which is really a hard topic to tackle. The top 2, cost of technology, 3, finding the right technologies, and 4, training staff adequately to use technologies, are related together and should not be regarded isolated. So it's really a hard cocktail for the organizations to tackle these challenges in order to get digital innovations done in healthcare. So bringing digital innovation into healthcare requires professionals and practitioners across different functions and sectors to work together around the needs of the people. So for example, in the inner line, it's about multi-professional teams in future to work across boundaries with multi-functional expertise. So this is covering clinicians, nurses working together with consultants, ITC professionals, analysts, and health managers. And even further, it's not only about the hospitals in primary care. It's about hospitals, it's about service providers, even pharmaceuticals, payers, education and research, and medical devices manufacturer, which are supposed to work together to drive digital innovations in primary care. So one topic is what we were faced most often is, what do you really understand about digital skills? So more precisely, it should actually be called transformative digital skills, since it really comes down to technologies to drive digital innovations and not the basic topics like how to work with the internet, how to collaborate virtual, or how to use MS Office. So what we understand about digital skills means about artificial intelligence and machine learning topics. It's about the basics of telehealth, mobile health, and the electronic health records. It's topics about robotics and, even more important, the cognitive robotics, cybersecurity, data analytics, and integrated health. And it's not only about, once you need to get digital innovations done, you need as well methodologies. So how to really approach to implement these things. So you need knowledge about how to do a kind of prototype and to get fast feedback on solutions and to decide to persevere, to pivot. It's about leading change, because once these technologies change processes and structures, and once you tackle these topics or change these topics, it's always about the culture. It's about how to work together, and you need really to cover that, because many initiatives fail due to these underestimated leading change issue. And a really important topic is about usability design of medical devices, because these ones guarantee accessibility and really enjoyable usability of software and hardware of medical devices. So talking about the top 4 challenge, training staff to adequately use technology is one thing. So it's something else to do it and how to do it. And the program we have designed and developed to tackle that challenge is based on the interplay of relevant transformative technologies. So you can see this one from M3 to M7. The required transversal skills, so it's the basement and the foundation, and management skills. And the learning objectives usually are that to get to support digital innovations or digital transformation, to close the gap between supply and demand, is that healthcare professionals need to understand transformative technologies and its impact on healthcare in order to really anticipate the impact on their own workplace. And it's about supporting digital transformations to really transform processes, structures, and cultures to seize these opportunities. And most important, really important, is to measure the value and the benefit of digital technologies to really convince the stakeholders to face these challenges. The core content, I've already mentioned something in the slide before, that about essential skills, and then one is really it's medicine, mobile health, and technologies, which are the basic for all other technologies. Leading health is about the topic of changing the culture or developing the culture once you introduce digital technologies. One of the most important technology issues is medical robots, because they, due to automation enabled by medical and cognitive robotics, the hospitals can reduce repetitive tasks in clinics and start releasing resources which can be invested in the direct care to patients. Once hospitals open their systems to the network, to the ecosystem, it is mandatory to take care about cybersecurity topics in order to avoid to get hacked and to avoid shutdown of and damage of healthcare and the whole operational part in the hospital. So with usability and user experience, I mentioned some minutes before, this is really to allow these to avoid a major pitfall that we all experience, for example, in the usage of technical advices, to really have a good user experience, to be motivated to use software or hardware devices. And that's about design thinking in medical context, accessibility to enable handicapped persons to use this without frictions, and to go along the European medical device regulation and not fail due to its requirements. For machine learning for precise medicine, the goal is to improve personalized health and individual outcomes by giving participants the tools for more patient-centered care decisions, by improving diagnosis, treatments, and monitoring of diseases, and even streamlining the administrative processes in hospitals. For example, thinking about bed management. So the hospital beds is really a constraint in the hospital, an important factor for generating revenues. And once there's always an issue in hospitals that there's a mismatch between patient stream and available hospitals. And with the algorithms in place, which are able to forecast patient flow and taking into account the actual capacities, this is a huge leverage, a huge trigger to really reallocate the resources much more effectively. And to get all the data for a kind of dashboard for bed management, you need data from different sources, inside or outside the hospital. And for that, there are an integrated care system, means that patients get really the health care they need when and where they need it. And there you need to know about the standards and features and how to design and develop such tools to get these data from different sources in a secure way. And not to forget about the management in the hospitals. It's about building awareness of the economic impact of digital health technologies. And it is really crucial to improve the competence of clinicians in the decision making and enabling them to focus on the value-based healthcare services, which will be supported by these technologies, and they need to know how to measure the impact. And this is more or less the management topic. And it's not about for itself. So with improving the digital skills in healthcare, it's not pushing technologies into the market. It's about really creating an impact through a desperately needed increase in the productivity. And there are two major fields of improvement we have in mind. So the first is the operational efficiency. Hospitals are small but high volume logistics centers between medical departments, laboratories, pharmacy, and food supply. So robotics will change the operational process in these hospitals fundamentally with automation and release resources to shift that into primary care. And this is what it is about, a greater allocation of nurse and physician's time to patient's treatment. And the second one is the redefined care delivery. So you can imagine about kind of air traffic control command centers to better manage the patient capacity and to get this interoperable data from different sources to improve decision making. And without these data, machine learning, for example, won't work. And these are the two primary goals once you enable healthcare professionals to work and to use these transformative technologies in the field of work. So unfortunately, not unfortunately, this is the second one. As we intended to develop a really international and interactive program, the development of use cases, so really demonstrate how these technologies have an effect in the actual operational setup of a hospital, will get in place. So we had intensive collaboration with the Oxford University hospitals to develop for each of these 8 modules use cases which demonstrate how these technologies can have an effect and can be implemented. I would like to give you a short, kind of feeling how this work or this exchange and collaboration with technological expert and with application clinicians in the field works. But I think once I run this video, due to technical disruptions, it does not work. And I really would like to make that video after our lesson available, that you can, if you're interested in, you get a link and can have a short access to this video. And I think this will not take more than 3 minutes to use, but I think it's a really interesting how these clinicians are thinking about these new technologies and what the effect in their field of work might be. So sorry for that. I'm really sorry, but at least it will I will make it available for you to get it afterwards. As we've expected to develop a really international program, we found out once we get the feedback from participants that it is really fruitful to have participants from all over Europe or even worldwide. That's providing really new perspectives and fruitful discussions between peers, because what we have seen in the maturity level of countries and sectors regarding digitization, each country has a specific challenge and they have partly solved challenges, are on the way to solve, and the experience shared in the discussions between peers, how do you solve topics, what are the experiences, are the benefits expected as realized as expected. So this is tackling, considering qualification of healthcare. It is really a benefit to think about really in a wider context, in an international context. And for example, with this program, we have participants from all over Europe, and with really incredible benefit and discussions from every part of Europe and even worldwide. And what was really surprising is that particularly if there's only one spot on the map, it's Latin America, which have really strong drive to use digital innovations to improve the healthcare systems. And so this is not to underestimate, to get these different perspectives into the peers and to overcome kind of barriers of cultural barriers and knowledge barriers to really drive these digital innovations. But maybe one think about how you get these healthcare professionals worldwide together to learn and to really be enabled to tackle these challenges in healthcare and apply digital technologies. So most of these units you need to invest about 4 to 5 weeks per course per unit, and the average learning effort to really get a first a profound understanding of the technologies and to support these innovations in the work fields, it's about 15 to 20 hours for a technology. And most of that will be done by self-paced learning with individual teamwork. So this is the peer work I just mentioned, to change informations and work together on use cases. And 1/3 is our virtual live sessions with the experts, which are developing these technologies. And there is usually we have been surprised that almost we had already I think about 300 participants in the courses, that already 1/5 of the participants have selected all modules. So they're really interested to get a profound understanding of the most important transformative technologies. But yeah, you need to have the time. And as I figured out at the beginning, that we have an overworked workforce, which has almost no time for further education. So it might be important to think about the kind of development track this healthcare professionals might think about. And we think about that you can have a kind of transformation focus, so really to understand the essentials and the leading change topics, and to measure and decide which kind of technologies are really important to implement. So this is a kind of transformation track. So this is more or less a team lead or development track. You can have a focus on the technology point of view, that you have these that really want to with the technologies to set up innovations in healthcare, and And yeah, what I mentioned is that you can even go for a championship certificate, and we got really good feedback to get an yeah, kind of unique overview of these transformative technologies, and then decide further on what is really important, which one of these technologies is really important to overcome these top 2 and top 3 challenges, which technology and what does the technology cost, and what can we afford and should we afford to invest to improve operational efficiency or to improve the quality of care. Yeah, so I think that is one of the last slides. So we have put, it's not that, it's a really big challenge to come up with a kind of qualification on transformative digital technologies, which are actually evolving in an exponential speed. And therefore, with the Oxford University Hospitals, what I mentioned, they are really involved in solving the big healthcare challenges in their ecosystem, and they were responsible and had a huge contribution to develop these clinical use cases and their validation. With Fraunhofer, we have this leading edge technology, and with Universitat de Barcelona, they are heavily involved in healthcare environment and driving data science, and particularly the human computer interaction in health.